treatment I'm going to be demonstrating today is the Nimue Active Rejuvenation Peel, which includes use of the Bioactive complex, which is pH 3 peel, and it helps to treat all sorts of skin concerns, so environmental damage, so fine lines and wrinkles, and even skin tone and texture, open pores. Also treats hyperpigmentation by micro-exfoliating the skin to help bring up the pigmented layers, and it can also help to decongest in the follicle as well, so we can treat acne breakouts. I've chosen this particular treatment for Carly today, as she suffers with a little bit of hyperpigmentation on the face and also some redness. So the peel is going to help to bring up all of that pigmentation and sun damage. And she's also a little bit concerned with aging, so this peel is also going to stimulate collagen production, hyaluronic acid production and elastin production to really plump out the skin. The treatment begins with cleansing gel, which treats most skin types and skin concerns. Can also be used as an eye makeup remover, as I'm about to demonstrate. Just going to use the cleansing gel on 2 damp cotton pads just to remove any traces of eye makeup. This is also suitable for contact lens wearers and is really good at removing waterproof mascaras. The client doesn't need a separate eye makeup remover. So this cleansing gel is suitable for the vast majority of skins apart from sensitive, although we do make a sensitive version. And that's quite nice because it means you don't need lots of products on your trolley. So this one's going to treat environmental damaged skins, hyperpigmented skins and problematic skins. I'm going to use the Nimue Professional gauze to remove. Gauze just makes the treatment really hygienic and also helps to exfoliate any dead skin. So the next product I'm going to use is the Nimue Conditioner. So this is a 7% alpha hydroxy acid product, not a toner, but it is used like a toner. So every time we wet the face, we'll use this product afterwards. And this is really going to help prep the skin ready for the more active treatment. Next, we're going to use the Nimue Exfoliating Enzyme. I'll be applying with a damp brush today. This one's suitable for all skin classifications, even the most sensitive skins. It's a non-granular enzyme-based exfoliator which contains enzymes from papaya and pineapple that are gently going to nibble away any dead skin cells to exfoliate the skin without compromising the skin's barrier. These enzymes work particularly well with heat, so you could use a steamer, which is really going to activate the enzymes in the product. Today I'll just be applying some hot water afterwards to activate, and then we can massage the skin then for 8 minutes. So for every professional treatment, Nimue recommends an 8-minute massage, which is really going to exfoliate the skin, but nice and gently without stripping the skin's natural barrier. We also have vitamin C in here to brighten the skin. So addition of hot water or steam here, we're really going to massage the skin to loosen off all of those stratum corneum cells. This is just going to really prep the skin ready for the more active treatment. And if you're not performing an active treatment, it's nice to just perform as part of the facial to really refine the skin's texture. And again, I'm just going to remove with gauze for hygiene to reveal a lovely glowing skin. And again, because we've applied water to the skin, we'll finish off with some conditioner just to remove any excess. And again, the acids in this are going to travel through the skin to help prepare it for the next step of the treatment. Next, I'm going to apply Hydrolip Therapy, which is a lip balm retail product suitable for really dry and sensitive lips. However, we're going to be using it today as a barrier to the peel. So on the lips, around the eyes, around the nostrils, and any open skin, like any open breakouts areas, for example, can be barriered anywhere where you don't want to peel. So now we are ready to apply the Bioactive complex, which is our 15% AHA pH 3 peels. This contains citric, lactic and glycolic acid to treat all manner of skin concerns, whether it's environmental damage, pigmentation or problematic skins. And I'm going to be customizing the treatment today with 2 of our Nimue Professional Super Fluids. So these can be mixed into any of the Nimue peels and also used with the Nimue microneedling treatments to help customize. We make 6 in total. And I've chosen vitamin C today for brightening to help with the pigmentation marks on model skin. And also we've got NAD, which stands for nicotinamide riboside, which gives energy to cells. So it's really going to activate the cells to give a really glowing complexion. It's also going to give a firming and lifting effect as well. Just mixing together in a 50-50 ratio. Just applying my Bioactive peel mix with my superfluid. Really important to avoid the eyes and the lips and any sensitive areas. This may tingle, especially if it's the client's first treatment. So we will be using a fan a little bit later to help cool down the skin. I'm just going to apply to the neck and décolleté as well, because we usually see sun damage here. And then we'll leave that for 3 minutes because this is Carly's first treatment. But as we do more courses of peels, we could increase the length of time we leave it on the skin, which will just see more results then each time. And using it in this way means that we get less downtime with each peel because the skin gets acclimatized to the ingredients inside. When it's time to remove the peel, I'm going to use 4 pieces of gauze in my Nimue rubber dish. Also have here the disposable compress, which will expand when we put it in some liquid. So we can either use this with water, like a face cloth, but today I'm going to be using it with a neutralizer to cool down the skin after the peel is removed. I'm going to use neutralizer as my medium to neutralize the peel. So this is a slightly alkaline pH, so it's going to bring the pH of the skin back up to normal and deactivate the peel. And the good thing about this peel is I can control when I want the treatment to stop, because all of the acids that we use are time dependent. So after 5 minutes, we use the neutralizer with our compress and gauze. So 2 pieces of gauze just soaked in neutralizer to start. I'm just going to dab the skin. We'll see some bubbles here, which just shows that the neutralization is happening. And you can see the skin's gone ever so slightly red, which is good because it means that we're getting that blood flow to really heal the skin post-treatment. So even though the client will see results immediately post-treatment, they'll continue to see results for the few days following while the skin heals due to the increased blood flow and circulation. I'm going to use my second piece of gauze then to physically remove the product, just to make sure there's absolutely nothing left. Just remember, our peels are time dependent, so we don't want to leave anything on the skin for too long, so it's just going to keep working. So my disposable compress is now expanded, so we can just unroll this and use it as a cold compress to really cool the skin down following treatment. Just going to lay this over the face just to really cool down the skin. And finally then we can use like a cloth just to remove any excess product. The next product I'm going to use following the peel is the TDS for hyperpigmented skin. Nimue make 4 different TDSs, standing for transdermal solution, 1 for each skin classification. So we have 1 for hyperpigmentation, 1 for environmental damage, 1 for problematic skin, and 1 for interactive or sensitive skin. I've chosen the hyperpigmented skin TDS to use on my model today just to try and treat the light pigmentation patches and also some of the post-inflammatory redness on the skin. This is really going to cool the skin down, help to restore the skin's barrier following peel so it feels less sensitive and hot. It's also going to help increase the healing following the peel because it's going to allow water to penetrate into the skin and it's going to lock that water in the lower layers. So we're just going to get an increased healing response by using this product, and it's also a brilliant aftercare product then following peel for the client to keep seeing those results at home. Following a peel, I like to use the alginate mask, which is a rubber peel-off mask. This is going to cool down the skin following an active treatment. It's also going to create a vacuum on the skin so that my TDS that I've just applied can really move downwards through the layers much more quickly. This is going to feel lovely and cold and soothing on the client's skin post-treatment. So we use this one after all of our professional peels and also after microneedling as well. As you can see, it can be applied straight over the eyes and the mouth if the client wishes to, so they get a nice cooling and soothing effect in those areas as well. And also to help with relaxation. So 10 minutes later then the mask is set, so we're ready to remove. So I'm just going to loosen it around the edges first. And we can feel all of the heat from the skin is absorbed into the mask during the setting time to really cool the skin down. Any residue I can just remove with some water. You can see the skin looks porcelain now. Lastly, I'll use Aftercare Hydrator, which contains eucalyptus, which is really going to soothe and calm down the skin following an active treatment. So after all of our peels, we'll use this one. And to finish then, we've got the Nimue SPF 40, which is also available for retail. This is obviously going to protect against your UVA and B, contains chemical and physical sunscreen, so it's not going to warm up the skin too much following treatment. It's also going to protect the skin then from UV post-treatment. So this has now concluded the treatment. And as we can see, the model's skin is looking much brighter. It feels more plump to my touch, even through the gloves. I can feel the refinement in the skin texture, also the pore size here, and we can see the coloration is much more even, and the redness has really calmed down after the mask as well.